knock.
Come in.
How you doing, love? My name's Jackie. I'm gonna be your nurse today. What brings you in?
I just need a physical.
Okay, you wanna do your annual physical today then?
Sure.
Okay, give me just a sec, love. Let me wash my hands. Alright. It's off. Go put these gloves on now. Alright, so I'll go ahead and take care of your annual physical for you. So can you tell me, if at all, pain level scale 0 to 10 right now currently?
I don't have any pain.
Okay, good. So would you say 0 out of 10 then?
0.
Okay, good. And then if and when you are in pain, what would you say a tolerable level is for you?
Probably about a 5. My pain tolerance is pretty good.
Okay, good. Also, let's start with then, I'm gonna do head to toe assessment on you. Let's start with your level of consciousness. So can you tell me first, last name, and your birthday, please?
Rachel Brennan, 2/21/1991.
Okay, outstanding. Can you tell me where we're at right now?
Countryside Hospital.
Okay, and who's the U.S. president?
Donald Trump.
Okay, good. And everything seems intact there. Any issues with any type of headaches? Any issues with memory currently? Anything out of the ordinary, I guess, is my point.
No.
Okay. So everything seems good there. I'm next gonna move into your actual physical assessment for you. Pain control at 0 out of 10, so that's outstanding. Go ahead and remove the rest. There you go. Hairband, you can just stick that on your wrist there. I'm gonna start at your head and work my way down, okay?
Okay.
Alright, so go ahead and lean forward a bit for me. Alright. I'm just feeling for any tenderness. Let me know if there is any.
Okay.
I'm feeling for any bumps of any assortment. Alright. Let me check my ears. Skin looks good. Okay. Scalp looks good, hair looks great, I don't see any abnormalities, any breaks, there's no lesions in your scalp, everything looks really good there. Okay, great. So next what I'm going to do is I want to go ahead and I'm going to shine my light into your eyes, your nostrils, your mouth, and your ears.
Okay.
Okay? So let's start. I'm going to start with the vision. Go ahead and lean up a little bit. Let's see here. Elbows, or excuse me, not elbows. Eyebrows look great. Alright. Sinuses in turn. Any tenderness?
No.
Okay, go ahead and lean up. Alright. Shine my light in there. Look great. Go ahead and open your mouth. Say ah. Alright. Pink. No dryness, moist, teeth look good and intact. Go ahead and reopen your mouth for me. Go ahead and tongue side to side. There you go, up and down. Good. Alright, and no tenderness with tonsils, anything like that?
No.
Okay, let's see. Go ahead and just look at the ceiling for me. Nostrils look good. Go ahead and turn this way and look at your ears. Those look good. Let me look behind them again. Good. Good. While we're at it, I'm going to do the hearing test real quick.
Okay.
So it's a whisper test. So I'm going to whisper in your ear and go ahead and repeat back to me what I said.
Okay.
Okay?
ABC.
Okay, good. I'm going to turn that way.
1, 2, 3.
Okay. And then next, this is a rhino test. We can do it briefly. I'm going to put this is like a small pitchfork, the top of your head. You're going to feel some vibrating, and let me know if you hear that okay on both sensations on both sides of your ears.
Okay.
Okay? Alright. Can you hear that on both sides?
Mm-hmm.
Okay. Can you feel it up top?
Yes.
Sensation's good?
Yep.
Okay. Alright, good. Alright, love, next, let's go ahead and I want to do, I'm going to go ahead and feel for all your pulses.
Okay.
So, let's go ahead and look straight at me. I'm going to go ahead and feel we'll start at your neck, I'm going to feel your lymph nodes, your carotids here. I'm going to take a listen, and then I'm going to work my way down, okay?
Okay.
So, And actually let me back paddle. Temples first. Strong and bounding, good. There. No tenderness? Okay, trachea. Good. Let me take a listen. Alright, I'm gonna go ahead and as I'm listening, I'm gonna quick percuss too, okay? Let me know if you feel any additional tenderness.
No.
Okay. Good? Okay. Alright. Let's knock out the rest of those pulses while we're at it so we don't forget anything.
Okay.
So go ahead and put your hands forward to me. Now is there radial? Good. On your stomach. What aortic? Yeah. Okay, that feels actually great. Okay, go ahead and put your hands straight for me. So what's important, along with the radial pulses, is checking your cap refill.
Okay.
Making sure your circulation is adequate. Okay? So I'm just gonna quick. Alright. Great. It's coming back within a few seconds. Completely normal and within range. Good. Okay. Good. Okay. And then while we're at it, let's go ahead and see. We'll finish up the pulses. But go ahead and reach straight out. Squeeze my hands. Okay, good. Go ahead and shake your fingers. Hands around. Okay, good. Move down to the floor, up to the top. Any pain there? Okay, good. All right, you can go ahead and relax. I'm gonna go ahead and your pulses here behind your. Good. Your ankle pulses. All right, good. Strong and bounding. All right. Feel your feet. Good. And then same thing I did with your hands there. I'm gonna feel for cap refill down here to determine your circulation.
Okay.
Okay. Looks good. Looks like that cap refill is returning within a few seconds. Everything looks pretty much normal. Pulses feel great. Okay, go ahead and rest yourself. So everything looks good there. Next I'm gonna listen to your heart and lungs and your stomach sounds, okay?
Okay.
Alright. So starting out, I'm gonna listen to your heart. I'm gonna listen to different valves. So first I'm gonna start and I'm gonna percuss as well. So I'm gonna fill as I'm listening. So first I'm gonna listen to your aortic, and we'll talk about this as I go. Your pulmonic next to it, and then your thoracic, and then your mitral.
Okay.
Okay? I'm gonna be listening for any murmurs. I'll listen first with just the regular side of the stethoscope, and I'll flip it to the bell to listen for that. When we flip it to the bell side, we're listening for anything abnormal such as murmurs. Okay?
Okay.
Alright. Alright. So let's start with the aortic. Any tenderness? Okay. Pulmonic. Mitral. Any tenderness at all? Okay. That was pretty normal there. Okay. Has anybody, you sound like you have normal S2, or excuse me, S1, S2 sounds. Has anybody ever explained to you what that means?
No.
So the S1 sound is when everything is regular for cardiac response. With the, I believe it's the mitral valve. And then the other is, the S2 is regular release from the mitral valve. Oh, excuse me, I said that already. The aortic.
Okay.
So as long as those valves are releasing okay, we hear the regular lub dub from the S1, S2.
Okay.
Okay. And then you said when I was, the percussion, when I was palpating those areas also, there was no tenderness.
Mm-mm.
Okay, discomfort at all?
No.
Okay, good. I'd like to next move on then and let's listen to your lungs.
Okay.
Okay, so go ahead and just sit upright. We'll start at the front there. And then when I'm listening to your lung sounds also, I'm going to monitor your breathing, meaning the movement of your chest in and out as well.
Okay.
Okay? Alright. Go ahead, deep breath for me. Good. Chest expansion looks normal. Okay. Good. Alright. We'll just listen to the sides since we're already here. Deep breath. Good. Any tenderness?
Mm-mm.
Alright. How about here?
No.
Nothing? Tenderness?
Mm-mm.
Now?
No.
Okay. And now.
Mm-mm.
Alright, let's go ahead and listen to this side just to make it even. Tenderness?
No.
Okay. Alright, go ahead and try your best to stay upright. I'm gonna listen to your back side.
Okay.
And I'm gonna look at to your, as you breathe in and out, I'm gonna monitor your back side to see that expansion, okay?
Okay.
Alright, deep breath for me. Palpate. Any tenderness?
No.
Okay. Deep breath. Good. Deep breath. Okay. Alright. Any discomfort at all breathing in or out?
No.
Expansion looks great. Looks like your body's responding well to those deep breaths, so lung sounds sound clear to me. Nothing was diminished, no crackles,
Okay.
and definitely no murmurs heard either. Listening to your heart, normal S1 and S2. Next thing I want to do is I'm just going to have you lay back
Okay.
and I'm going to listen to your bowel sounds.
Okay.
Now, moving on to that, has everything been regular for your bowel movements?
Yes.
Okay, when was the last time you had a regular bowel movement?
This morning.
Okay, no issues with diarrhea, constipation, anything out of the norm?
No.
Okay, go ahead, lay back, love. Alright, just breathe normal. And as I'm doing this, listening to your bowel sounds, I'm going to kind of palpate and percuss as well.
Okay.
Okay? And just listen to hyper, hypoactive bowel sounds. Any discomfort?
Mm-mm.
Alright. Good now? Alright. Tenderness. Okay. There's definitely some growls in there. Probably get lunch after this. Alright, good. And then, without listening, I'm gonna feel around for your kidneys and liver.
Okay.
Just gonna move around this general area and let me know if you feel any pain or discomfort, okay?
Okay.
I'm gonna kind of percuss and palpate. Nothing feeling tender?
No.
Okay. Now? This side?
No.
Okay, good. Okay. Go ahead and sit upright for me. Stomach sounds hyperactive. I just heard some growls. Probably hungry, need to eat some lunch. Really. So far, definitely alert and oriented. No issues with confusion. Heart sounds great. Normal S1, S2 sounds. Let me actually come to think of it. I promised you to listen with my bell and not just the original. Let me flip this around so I don't forget to do that for you. And then again, for the bell portion of this, I'm just listening for murmurs.
Okay.
Okay? So go ahead and breathe normal. Good. 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 And listen to Herb's point with the bell. Good. Let me flip that around. This side. And Herb's point again. Everything sounds regular there. Okay, so we already checked the cap refill on your fingers and your feet. Pulses felt great. Next area I really want to focus on is your range of motion.
Okay.
So at one point I'm going to have you stand, but for now I want to focus on the hips first.
Okay.
So go ahead, if I can have you lay back for me. Okay. And then with this, first let's start out at one knee at a time. So with your right side, go ahead and put knee to chest. And then we're gonna go ahead, okay, good, bring it back. Any pain, any issues with the,
No.
okay. Go ahead and bring it outward. Abduct, there you go, bring it back in. And then the opposite side, out, bring it back in. Any issues with pain at all?
No.
Okay, go ahead and extend your legs towards me. Okay, and then bring it back to your chest again. Okay. All right, and then so from here, I'll go ahead and can you point your toes at the floor? Good. Bring them up. Any issues there?
No.
Okay, and then this may be a little bit awkward for you, but if you can go ahead and thrust. There you go. Any issues? Any
No.
cracking? Nothing, no discomfort, nothing out of the, okay.
No.
Okay, good. Alright, so next, so let's focus on the range of motion. I'm gonna go ahead and have you, well actually you can do this sitting, but go ahead and look straight forward at me, and we're gonna focus at your upper region. So focus at me, go ahead and shrug your shoulders. Good. Go ahead and move your head. There you go, in that way. And then look at the ceiling, look down, and go ahead and do a circle. Any pain, discomfort at all?
No.
Okay, good. Next, let's go ahead and put your arms out right, and let's focus on the elbows first. So go ahead and bend up. There you go. Go back down. Go ahead and move side to side. Yeah, there you go. All right, good. Can you go up towards the ceiling? Down, good. Okay, so range of motion in the shoulders and the arms looks good. Let's focus on the wrists and those fingers. So go ahead and go straight out. Do a circle for me. There you go. Go back and go outward, inward, dog, and then do a full circle. Good. I'm gonna check your grip, your finger strength. So tight as you can. All right, those are strong and equal. And then go ahead and good. All right, any issues with there aside from the cracking? No, it's mine are cracking too, so it's fine. Okay, so elbows are good, wrists good, fingers, grip strength are solid, no issues there. Next, let's go ahead and I'm gonna have you stand up and we're gonna focus. We already did the hips and the upper extremity and your neck. Everything was good. So next we're gonna focus on the vertebrae and your leg motion standing up. Okay.
Okay.
So go ahead and stand up for me. Let's start with the, I'm sorry, I'm gonna get over this idea. Let's go ahead and start with the vertebrae, right? So go ahead and bend forward. There you go. Come back, and then kind of bend backwards. Okay? And then go round and round there. Okay. Aside from the cracking, anything, any discomfort? Good? Okay. So that's good. Vertebrae, nothing irregular there. With your legs, now that we're standing up, I know I had to do this on the examination table as well. But go ahead and bring your knees one at a time, chest. There you go. There you go. All right, and go ahead and outward. Other one. Good. Okay, and there you go. Back. And then back. Okay, and then let's see where those ankles are at, just in your balance and coordination. Go ahead and balance yourself best you can on your left. Bring it right up, bring it around circles. Good. There you go, circles on the other. Any issues there? No? Okay, go ahead and grab a seat. Let's see, we already assessed the knees. Ankles good, hips good, upper is good, vertebrae is good, neck's good. No pain at all.
No.
Okay, good. You do yoga?
Yes.
Okay, you could have, I was gonna say, if you said no, you could have fooled me. Okay, alright, so let me just, let's see. So I think we have Covered for the most part. Good thing, range of motion.
Mhm.
Heart and lungs sound great. Pain scales down there. You're alert oriented. We covered pulses. Cap refill was good. Next, what I want to do is patients sometimes when they get admitted on the floor, we thoroughly check over their skin. Down in Florida, skin cancer sometimes seems to be a problem, not always for just elderly patients. So I'm just going to look over your skin head to toe. Go ahead and first hold your arms out for me. Look. Good.
What was that?
I was just checking the elasticity to
Okay.
make sure it bounced back. It was very good to go. Usually if you do that and it doesn't go back right away, we have an issue, but you're good to go there. I'm just gonna check up here. Good. And then if you don't mind, I'm gonna pull the back of your shirt up. Just look at your back. Your skin. A lot of times we get moles back there that we don't see. Okay, good. Alright, other hand, or excuse me, arm. Good. Alright, I'm gonna turn over. Good, nothing's open. And then I'm gonna do the same thing. Alright. Nothing's open. Let's see those legs. Extend there. Good. And okay. And then do you go to the beach often at all?
No, sometimes.
Okay. You normally wear sunblock?
Mhm.
Okay. Alright. So I'm gonna quick look over your chart right now and
Okay.
just make sure that there's anything we didn't cover that still needs addressed real quick, okay?
Okay.
Alright. Let's see. So I think we still need to look at that vision. And then that looks good. We checked the stomach, hips we covered. Vertebrae is good. Okay. Let's go ahead and check. Do you wear contacts at all?
No.
No. So 20/20 vision. I'm not so much blessed. I've had glasses since second grade. I wear contacts now. So I'm just gonna do a quick vision test on you. I'm gonna check your pupil constriction and your dilation, just reaction to the light. Okay.
Okay.
So I'm gonna turn on my light now, and then I'll just ask you focus to the tip of the light and follow it for me. Okay.
Okay.
So we'll start on this side. All right. Go ahead and focus on that.
Mhm.
Follow the light. Good. No hesitation there. That looks good. Okay. Follow the light for me. And back. Okay, good. Next, I'm gonna go ahead and I'm gonna cover your right eye first, and let me know if you experience any type of any dizziness or blurriness, anything out of the norm in the other side. Okay.
Okay.
All right. Go ahead and follow my finger. Go over. Were you able to keep sharpness?
Mhm.
Okay. So that. Focus in on just the tip of my finger. Move over and back. Feel okay?
Mhm.
Okay. And then I want to triple check too. Pretty sure I got a good look at your teeth and have you ever had your tonsils out at all?
Mm-mm.
Okay. Go ahead and open up for me and shine my light in there. Say ah. Okay. Tonsils reactive. Everything looks pink. Is your mouth? You have any problems with dryness, mouth dryness, anything?
No.
Okay. Open back up. And look at those teeth. No cavities. And then go ahead and while we're at it, I'm pretty sure I already had you do it, but I'm going to do it again just for thoroughness. Go ahead and open your mouth and tongue side to side. Okay? And top. There you go. Alright, good. No issues with tenderness, anything in the mouth?
Mm-mm.
Okay. Alright. And let me shine my light one more time in those ears. Good. Alright. And then just for thoroughness, I'm going to do the whisper test one more time for you. So go ahead and repeat back what I say in your ear.
Okay.
Okay?
ABC.
Okay?
1, 2, 3.
Okay? Good, good, good. Alright. Everything looks pretty good for the most part. No issues. Skin looked great. Heart and lung sounded normal. S1, S2, no diminished lung sounds. Everything was clear. Upon palpation, chest rise, okay, and back, there was no hesitation, no pain while taking those deep breaths, correct? Okay. Is there anything you want to bring to my attention this time that you'd want to address when the doc comes in, now that we've done your full assessment?
I don't think so.
Okay. Alright. Any issues with family history? Any additional testing you'd want to have done commonly, normally, like, for example, if your mother or your father's diabetic, if you have any diet concerns, anything, I mean, prevention is key and screening is key. So, I mean, you're still pretty young, but I always think it's best rule of thumb to address any medical issues that you have, a higher, like if your parents were diabetic, for example, you have a higher risk of developing that disease as well. So I didn't know if you have family history of any type of cancers, diabetes, cardiac issues.
Both my parents do have diabetes, so I'd like to be checked for that.
Okay. Do you have any? We can put in a referral too for dietary. If you have any dietary concerns.
I'm not so much
dietitians
concerned
with
about
you?
that. I just want to make sure that I'm not diabetic.
Okay, no problem. I'll go ahead and make note of that in your chart and address that with the doctor, and then he may want to run some tests today. Worst case scenario, schedule you later this week or next week for outpatient
Okay.
for you to do the testing whenever the doc wants.
Okay.
Okay. So any other concerns other than that?
I don't think so.
Okay. Are you on any current prescriptions? Health-wise, birth control, anything like that you need readdressed or refilled at this time?
No.
Okay. I forgot to ask you when the date of your last menstrual cycle was.
I'm currently on it.
Okay, so no pregnancy concerns.
No.
And then you said no prior pregnancies.
No.
Okay. All right. So currently, so no issues there. A lot of the times with that, when people get on birth control and then remove themselves from it, you always, or starting it, whichever, you always run the risk of blood clots, of DVTs. So
Okay.
it's nothing to take lightly. So okay. So you're good to go, love. I'm gonna wash my hands. I'm gonna step out and I'll page the doctor and let him know that your assessment's done, and then he'll be in to talk to you shortly. Okay.
Okay, sounds
Okay.
good.
Let me wash my hands real quick, and then I'll go ahead and let the doctor know you're good to go, love. No
Okay.
questions for me?
No.
Final chance. Speak now. Forever hold your peace.
No, I'm good.
Okay, love. I'll be back in shortly with the doc. Okay.
Okay, thank you.
You're welcome.